Well, you know, the word hypnosis might make you think of a swaying of a pocket watch or a stage hypnotist having participants bark like dogs and quack like ducks. Well, that might be entertaining. It is far from reality, and hypnotherapy is useful to treat a wide range of conditions in a clinical setting, and it can be used for children and adults alike, and used very well and help them very much. So we have Dr. Erin Erickson. She is a nurse practitioner and also the co-host of the Mom Enough podcast. Of course, you normally see her mom here, and she is out west enjoying some sunshine. So it's so good to have you here as well.
Thank you so much.
You and your mom have just a phenomenal podcast, so many interesting subject matters. Okay, so let's talk about, and I was not aware of this, but this is so unique to me versus always having to rely on prescriptions, hypnotherapy.
Yeah, it's totally an interesting thing. I think, like you said, we've seen examples of this in literature. Maybe you've been to a stage hypnotist, and that's not really what it's like. So hypnotherapy is a type of mind-body medicine, and so it uses the mind to help the body and the mind. And so in many ways, it's similar to like guided imagery or guided meditation, but with the addition of positive suggestions. And so when you're in that really relaxed state, your mind is more open to positive suggestions. And so those suggestions can help you kind of change your outlook, change your perception of pain and other symptoms. And so in many ways, it's kind of like, unlike being zoned out, it's very much like being zoned in. So you're really focused.
So your mind
relaxed.
is clear, and
Yes.
so you're helping, let's talk about children. You're helping children with anxiety, depression. You're helping them with what other things through hypnotherapy?
Yeah, so pain, for example. So they actually do this a lot at both Children's Hospital and at the University of Minnesota in behavioral pediatrics. So, for example, if a child is having a lot of pain, maybe it's really severe pain associated with a cancer diagnosis, or maybe it's an upset stomach and nausea associated with anxiety. So the goal of hypnotherapy and clinical hypnosis is to actually teach people to use these techniques for themselves, so they're kind of building their self-care toolkit.
And so someone that is obviously trained in this comes in the room and does that for the children or adults.
Exactly, and then you're teaching them the technique. So with my patients, I'll often record the session, and then I send them the recording and they can listen to it on their own. But in time, they learn the technique and can just do it for themselves.
Wow, that's great.
Yeah.
So then they're doing their own hypnotherapy, but more of like a modified meditation, right?
Exactly.
So here are just some of the, the myths around hypnotherapy, that the hypnotherapist can control you. It's not the case.
Yes, absolutely not the case. So I think when we see those stage hypnotists, for example, having people do things, those are willing participants. And so patient and clients are in control during the process. They can stop, they're aware, they can, change the process, they can say something. So they're not under my control or their clinical hypnotist's
So they're
control.
not stuck in it, as
Exactly.
we mentioned that as well. And you will not be aware of what is happening. So you are aware. You are aware of what's happening.
Exactly. And you can remember what happens. Now, sometimes there's something called post-hypnotic amnesia. And I liken that to, like, let's say you went to a lecture and you kind of got distracted. You might not remember every detail. So you're focused, you're relaxed. You might not remember every detail, but when you're done and you're processing it with your clinician, you're going to likely remember more and more. And of course, most clinicians will record it or at least teach you the technique so you know what's happening and you can do it on your own.
So you have a podcast with your mom about this, right?
Exactly, yes. This week we are talking about clinical hypnosis, and in a little twist, I'm the guest this week. Usually I'm the co-host with my mom, but this week I'm the guest.
Because this is what you're doing.
Exactly.
And you're really seeing benefits from this.
Oh, absolutely, yeah.
Wow.
So, decrease stress, reduce pain, even hot flashes for women in menopause and perimenopause. So there we go.
Who knew?
Yeah.
What a great idea. Erin, thank you so much for coming in. We do appreciate it. It's good to see you. You can dig deeper, as she mentioned, in this topic on the Mom Enough podcast. It is brand new and is released on Mondays, and we have a link on KARE11.com.